One of my patients, Gary, is 68 years old, retired engineer, sharp mind, strong will. And for 3 years, every single night, he'd lie down in bed and feel it, a crawling, buzzing sensation starting at the balls of his feet, climbing toward his ankles. Some nights it was burning. Some nights his feet were so cold his wife could feel it through the blanket. He told me, "Dr. Kent, I've Googled everything. Nobody tells me why it's happening." That's exactly what today is about. I'm going to give you 7 specific evidence-backed remedies for foot pain, tingling, burning, and that heavy swelling that won't quit. And I want to tell you right now, numbers 4 and 6 are things I almost never see discussed anywhere, even in clinical literature aimed at patients. Stay with me through all 7. Before we get into the remedies, I need you to understand what is actually happening inside your feet when these symptoms appear. Your feet contain over 200,000 nerve endings. They are the most densely innervated region of the lower body relative to their size. When blood sugar runs even slightly elevated, not diabetic range, just above optimal, those nerves begin losing their protective myelin sheath. That's the coating around the nerve fiber, like insulation around a wire. When it thins, signals misfire. That misfiring is what you feel as tingling, burning, or numbness, separately. When circulation drops, from sitting too long, from arterial stiffness, from venous insufficiency, your feet literally starve for oxygen. Both processes can happen simultaneously, and both are addressable. That's what these 7 remedies target. Remedy 1, I call it the post-meal activation window, and the research behind it is more compelling than most people realize. A 2013 study published in Diabetes Care found that light walking after meals reduced glucose. What does that mean for your feet? The 10 to 15 minutes immediately after you finish eating are the highest risk window for a glucose spike. That spike, repeated daily over months and years, is one of the primary drivers of peripheral neuropathy in adults over 60. The intervention is simple. After every meal, breakfast, lunch, dinner, do not sit down for at least 10 minutes. You don't need to go outside. You don't need shoes. Walk slowly from your kitchen to your living room. Fold laundry. Stand at your counter and make a phone call. The body doesn't care what you're doing. It cares that your large muscle groups are active and drawing glucose out of the bloodstream. Here's the mechanism. Skeletal muscle contains GLUT4 transporters, glucose receptors that activate during movement and pull sugar directly into the muscle cell without requiring insulin. In plain terms, your legs become a glucose disposal system the moment you start moving. For Gary, this single change, nothing else, just 10 minutes of slow movement after dinner, reduced his nighttime burning by nearly half within 3 weeks. 1 habit, real results. Remedy 2 is a self-assessment I want you to perform tonight and every night this week. I call it the bilateral temperature check. Here's how you do it. After you've been lying still in bed for 5 minutes, reach down with one hand and touch the sole of your left foot, then your right. Then touch the top of your left foot, then your right. You're checking for 2 things. First, are both feet equally warm, or is one noticeably colder than the other? Asymmetric coldness, one warm foot, one cold, can indicate unilateral arterial compromise. That is a finding worth bringing to your doctor. It is not something to manage alone. Second, are both feet unusually cold despite being under blankets? Bilateral coldness, especially in someone over 60, is frequently a sign of reduced peripheral circulation, often linked to arterial stiffness or early-stage venous insufficiency. Now, here's the part most videos skip. If you detect significant bilateral coldness, there's an immediate intervention you can use while you work on the longer-term fix. Before you sleep, sit on the edge of the bed and do ankle circles. 10 rotations clockwise, 10 counterclockwise on each foot. Follow that with 30 seconds of heel raises while seated, pressing up on your toes repeatedly. This activates the soleus muscle, which sits deep in your calf. The soleus is sometimes called the peripheral heart because its pumping action is one of the primary mechanisms returning venous blood upward from the feet toward the chest. Even 30 seconds of activation increases distal circulation measurably. The coldness in your feet isn't just uncomfortable. It's your body telling you the pipeline needs clearing. Remedy 3 targets something structural that almost no one addresses, and it directly causes the tingling and numbness. Your toes were designed to spread. The plantar fascia, the band of tissue running from your heel to the base of your toes, functions optimally only when your toes have full range of motion. Modern footwear, even comfortable, well-fitted shoes, compresses the forefoot and restricts that spread over years of wear. That compression loads the small intrinsic muscles and the digital nerves between your toes. When those nerves are chronically compressed, you get tingling, burning, and a sensation like walking on pebbles, even when you're not. The exercise I'm about to show you takes 2 minutes. Sit down comfortably. Place a small hand towel flat on the floor in front of your bare foot. Now, using only your toes, no hands, grip the towel and drag it toward you. Then splay your toes wide and push it back out. Repeat this for 2 full minutes, 1 foot at a time. What you are doing is reactivating the lumbricals and interossae, the small muscles between your metatarsal bones that modern footwear gradually switches off. A 2019 study found that intrinsic foot muscle training significantly reduced plantar pain and improved nerve function scores in adults with neuropathy. 2 minutes. No equipment. The results aren't cosmetic, they're neurological. Gary started this in week 2. By week 4, the pins and needles sensation during the night had dropped to once every few days instead of every night. Remedy 4? This is one of the 2 I told you to stay for, and I want you to pay close attention. Most discussion about foot swelling focuses on sodium or kidney function. Those are real contributors. But there is a third mechanism almost never discussed with patients, and it explains why so many seniors wake up with feet that feel like sausages. It's called nocturnal venous pooling. Throughout the day, gravity pulls fluid down into your lower legs and feet. Your calf muscle pump and your venous valves work to push it back up. But as we age, those venous valves become less competent. Fluid leaks backward and settles. By evening, it's pooled in your ankles. By morning, it hasn't fully reabsorbed because you've been lying flat, not elevated. The fix is a positional one. Place a folded blanket or 2 firm pillows under your mattress at the foot of the bed, raising your feet approximately 4 to 6 inches. This is passive. You do nothing. Gravity does the work overnight, drawing that fluid back toward your core where your lymphatic and venous systems can process it. This is called Trendelenburg positioning, and it has been used in clinical settings for decades. The difference patients notice typically appears within the first 3 nights. Ankles are thinner in the morning. The heaviness has gone faster. Shoes that felt tight by afternoon start fitting normally again. This costs nothing. It requires no medication. And it works through basic physics, not guesswork. I want to pause here for a moment. If you are experiencing tingling, burning, or numbness in your feet right now, go ahead and type the word burning or cold in the comments below, whichever matches your experience. I read these. I use them to decide what to go deeper on in future videos. And if this information is genuinely useful to you, please like the video. It's the signal that tells the algorithm this content should reach more people like you who actually need it. Now, Remedy 5. Remedy 5 is a nutritional one. There is one deficiency with a strong connection to burning feet. That is vitamin B12. Here's why seniors are specifically vulnerable. The absorption of B12 requires a protein called intrinsic factor produced in the stomach lining. As we age, stomach acid production declines. So does intrinsic factor. Additionally, metformin, one of the most commonly prescribed medications for type 2 diabetes, directly depletes B12 with long-term use. A 2010 study found that long-term metformin use was associated with significantly reduced B12 levels. The nerve symptom connection is direct. B12 is required to maintain the myelin sheath. When B12 drops below optimal range, myelin degrades. The first place most people feel it is in their feet, burning, electric shocks, hypersensitivity to touch, or paradoxically, loss of sensation. It can start subtly, almost easy to ignore at first, a slight tingling at the end of a long day, or a strange numbness that comes and goes without warning. But over time, it becomes more persistent, more noticeable, and harder to dismiss. For some, it feels like pins and needles that never quite go away. For others, it's a deep, uncomfortable burning that makes even the lightest touch feel unbearable. And in some cases, it's the opposite. A dull absence of feeling that can be just as dangerous because you may not notice injuries or pressure building up. The solution is not just taking any B12 supplement. Many people make the mistake of grabbing the first option they see, assuming all forms are equal. But they're not. The form with documented superior absorption in older adults is methylcobalamin, taken sublingually, meaning dissolved under the tongue. allowing it to enter the bloodstream more directly. This method helps bypass the digestive absorption problem entirely, which becomes increasingly common with age when the body's ability to extract nutrients from food and standard supplements begins to decline. Before starting any supplementation, ask your physician to check your serum B12 level. This step matters more than people realize, because guessing can lead to both undertreatment and unnecessary excess. The test is inexpensive and often covered, making it an easy and practical first move. You want to know your number, not guess at it. Not assume, but actually see where you stand, so any action you take is based on something real and measurable. Remedy 6. I call it the weekly foot audit, and you must do it in natural light. Take your feet to a window on a bright day. Not artificial light, not a dim room, but clear, natural daylight where you can actually see what's happening. Sit down, get comfortable, and take your time with this. Because what you're doing here is not casual observation. It's a deliberate check. You are looking for 4 specific things, and each one tells you something important about your circulation, your nerves, and your overall health. First, color variation. Look closely at the tone of the skin, not just at a glance, but carefully comparing different areas. Bluish or dusky purple discoloration indicates cyanosis, insufficient oxygen reaching the tissues. This is not subtle, and it is not something to monitor over weeks. That is a call your doctor today situation, not tomorrow. Not when it's convenient. Today. Second, nail changes. Pay attention to the thickness, the texture, and the color of your nails. Thickening or yellowing are signs of fungal infection, and while that may sound minor, it can become persistent and difficult to treat if ignored. Early recognition makes a difference, and it prevents the problem from spreading or worsening over time. Third, skin texture. Run your fingers lightly over the surface. Skin that is becoming thin, shiny, and hairless is losing its blood supply. It may look smooth, almost polished, but that appearance is not a good sign. This is an early warning signal of peripheral arterial disease, and catching it early gives you a window to act before more serious complications develop. Fourth, any wound or sore that hasn't changed in 2 weeks. Not healed, not improved. Just sitting there, that is a wound care evaluation, not a home treatment. No guessing, no over-the-counter fixes. It needs proper assessment. Remedy 7 involves your magnesium status. 20 minutes before you intend to sleep, fill a basin with comfortably warm water. Not hot, not steaming, just warm enough that your feet relax the moment they touch the surface. This timing matters because you are preparing your body to transition into rest, not stimulating it. Add 2 tablespoons of magnesium sulfate, sold universally as Epsom salt. Measure it, don't guess, because consistency is part of what makes this work. Stir it briefly until it dissolves, then place both feet into the water slowly, allowing them to adjust. Soak both feet for 12 minutes exactly. Not 10, not 15, 12. Set a timer if you need to, because precision here is not accidental. During those 12 minutes, stay still. No distractions, no phone, no multitasking. Let the warmth and the magnesium do what they are supposed to do, gradually easing tension, calming the small nerve endings, and preparing your system for sleep in a very deliberate way. Then dry your feet and apply a thin layer of unscented lotion, not perfumed, not medicated, just a simple, clean